Hi, everyone. Welcome to our CUNY TV virtual roundtable. I'm Donna Hanover. Our topic today is mental health, particularly amid the challenges of COVID-19. And we will also specifically focus on how the pandemic is affecting the mental health of people who are part of the City University of New York, and what mental health resources are available if you or your friends or someone in your family needs them. And a little bit later, we'll be talking about the vaccines that are on the horizon and how that might affect mental health. So just to give an overview, nearly 1 in 5 adults suffers from a mental illness. That's according to the National Institute of Mental Health. The number is even higher for young adults ages 18 to 25, with almost 30% suffering from some type of mental illness. And the pandemic has made things much worse, with people feeling isolation and anxiety, the stress of job loss, fear of having to take transportation, difficulties with online learning, distress about not being able to pay the rent, and worries or grief about COVID affecting those we love. For the CUNY community, something important was announced in October. CUNY began a $5 million expansion of mental health resources, and this includes a large increase in face-to-face online counseling and other kinds of remote wellness services. This money came via the CARES Act that Congress passed in the spring, and it was needed. According to a survey from spring of 2020, 73% of CUNY students had a decreased ability to do their work because of emotional and mental health issues. But some help is on the way. Our guests today bring different kinds of expertise to our discussion. Ryan Camayer is the University Director of Mental Health and Wellness at CUNY's Central Office of Student Affairs, and he provides guidance to all of CUNY's counseling and health service centers. He's a licensed social worker, and he's also a doctoral student at CUNY. Melanie Cravelas is a senior manager for the Young Invincibles New York office, where she researches issues affecting young adults, including, college affordability, immigrant health, and young adult unemployment. Her research has been cited by the U.S. Department of Education. And Dr. Gerard Bryant has been the Director of Counseling Services at John Jay College of Criminal Justice since 2014. Before that, he spent 22 years in the Federal Bureau of Prisons, primarily as a psychologist, and he's trained many professionals on substance abuse, suicide prevention, sexual assault and prevention, and stress management, among other topics. So let's begin. Ryan, what are you seeing in terms of mental health among young people right now?
The word unprecedented keeps being used a lot, and I hate to use it again, but really we are seeing an unprecedented mental health crisis right now, and especially among young people, especially among people in college, and obviously what I'm seeing at CUNY through my work is that the needs are escalating. The topics of interest in mental health are changing somewhat. There's more people seeking help for isolation, for trauma associated with COVID-19, for academic problems and home problems as people have been home. So really we're seeing an uptick in the needs for mental health, and we're also sort of facing the headwinds of funding from a lot of different areas, and how challenging it's become to make sure that the resources are properly in place.
And so, Melanie, what are the specific challenges that you're seeing students face in the pandemic?
CUNY is this institution that serves so many different New Yorkers, including low-income New Yorkers, Black and Brown New Yorkers, young parents. We know that it is really this institution that's serving all sorts of New Yorkers. And with that comes a lot of particular mental health challenges, particularly right now. One thing I keep in mind quite often when I think about this issue is sort of the related homelessness crisis that is impacting New Yorkers across the city, and of course here at CUNY. Even before COVID-19, we knew that more than 1 in 10 CUNY students experiences homelessness in a given year. And I bring that up when we talk about mental health because, Donna, as you sort of said at the top, all of these different issues that are happening right now with COVID, whether it's, the isolation, whether it's losing your work, whether it's suddenly having to transition into online learning and, all of the stresses that can be a part of being at home right now. All of those are impacting people's mental health. And when I think about, again, students experiencing homelessness in this crisis, I think about, again, these are students who may really be needing the support of mental health services, but, depending on where they're staying, they might not have access to, a private space where they can speak with a mental health counselor. If they're in the city shelter system, for instance, they might not even be able to access Wi-Fi in that shelter system. I think it's really critical that, an institution like CUNY is, using things like the CARES Act funding to make sure mental health services are available. And, we were really glad to see that that's where part of, there are, without, necessarily knowing when the next federal stimulus is coming in, we know that resources are limited. So using that funding for mental health is key, but there are issues that students do face when trying to access the services that are available now. So whether that could be, wait times at a particular campus, again, it can vary from campus to campus. Some have longer wait times than others, some have none at all. Some of these issues can really impact students.
And Gerard, are you seeing more requests for mental health services during the pandemic than in normal times at John Jay?
We are, and I would stress that more dire need from our students. Although the numbers may not reflect an uptick, the sense of urgency certainly does, for all the reasons that my colleagues cited earlier. The intertwine between emotional and mental health of our students and our family and their families and the economic devastation this pandemic has wreaked on our society. It's borrowed Ryan's term, it's unprecedented. We talked about homelessness, food insecurity, a huge issue, which was already present before. These issues were present before the pandemic. Also, one other thing that we sort of maybe not touched on, COVID-19 itself and the impact that it's had on the families. We've had students who've lost multiple family members. The fear of contracting COVID-19 is very real. And the fact that they cannot grieve and bereave in a normal way has also had a tremendous impact on our students. So yeah, our students are certainly reaching out more, but also more intensely and more urgently.
Very, very good point. So Ryan, how was the $5 million for increased mental health services, how was that allocated, like across the whole CUNY system?
A portion of it was designed to be spent as shared services across the university system. So basically things we could acquire centrally. And a lot of them are technological solutions to some of the problems we've been facing, to make sure that our medical record systems are up to date, to provide services for those that are not able to access services at this point. While all of our counseling centers have gone virtual since March, and we're able to offer those services, we're also focused heavily on crisis resources to make sure that students are able to access services or crisis outreach counselors 24/7, because as Gerard said, there are so many more urgent, dire issues, and people are having crises more often. So we're focused on those solutions centrally. The second part, the funding has been distributed evenly between the campuses. So what we've been able to do, because so many of our campuses operate differently and have different services and different
bodies.
Yeah, there's so much difference, as everyone is aware at CUNY. We felt it was helpful for each campus to sort of make decisions about how they wanted to operate their own funding. And A lot of them are using it for personnel to increase the amount of obviously visits that we can do, but there's also other solutions, technological solutions, and additions to the counseling center that will enable services through the end of the semester.
So Melanie, are you hearing from CUNY students who've said, oh, I've noticed that it's easier to get through to somebody, or is that impact not being felt yet?
We know that there are folks all across CUNY, including the great folks on the call here, who are doing everything they can with the resources to make sure that students are getting access to that mental health care. But I think in reality, and maybe as a non-CUNY representative, I can say this more easily on the call, but I think it's also going to take serious investment from the state to really make sure that these services are reaching students. And again, I think the CUNY community is trying to think creatively about sort of the resources that are available, including that CARES Act funding. But the reality is, again, we haven't seen a serious federal investment in our states, since March in this crisis, which is, if you want to call it unprecedented, there's another one right there.
Gerard, are students that call in for help, trying to get online help that isn't face-to-face at John Jay, are they feeling satisfied? Does it solve the problem or at least advance their situation?
I'm happy to report that our students so far, we haven't received any really major complaints about students having access to our remote operation. And there's avenues that students can certainly voice their complaint. We have town hall meetings that are monthly. Our VP is very big on feedback and customer service. So I've not gotten that much feedback. A lot of it is the support of the administration, who tries to tout our services every opportunity they have, and even gives me a voice and my staff a voice. Professors and staff who make referrals, it's key for us. I think that once the referral is made, that we jump on that right away. And try not to the extent possible, refer the student out. Try to deal with it hands-on at the school. That makes it, because for the things that Melanie talked about, sometimes when you're dealing with outside referral agencies, they have waiting lists. I mean, there's a great need in the community. Yeah. And our students are not going to get, the first priority because they're CUNY students. So we try to deal with them. And some students, frankly, may only need a few sessions to deal with their issues. They're not talking about long-term treatment. They're just looking to develop some coping strategies for what's happening in the moment.
We've got a lot more to talk about, including the vaccines that are right there on the horizon and how that might affect mental health. So we'll be right back in a moment with more from our roundtable. Welcome back to our CUNY TV virtual roundtable on mental health in the era of COVID, especially focusing on the challenges and help for people at the City University of New York. I'm Donna Hanover, and with us are Ryan Camayer, Melanie Cravelas, and Dr. Gerard Bryant. So a vaccine is on the horizon. At least 2 companies, and I think even more, have shown that their vaccines are safe and effective, at least in the short run. So there's a lot of excitement about this and a lot of concern about it. So Melanie, I'd be interested to know, are you confident that young people will take the vaccine when it becomes available, or do you have concerns about online groups urging them not to? What do you think will happen?
At least speaking from personal experience and the young folks that we work with, particularly in the CUNY system, I think, yes, they are ready to take the vaccine. I think, a lot of folks, especially within the CUNY system, we're talking about New Yorkers living in multi-generational households. They might be living with their grandparents or younger siblings, or, they're essential workers themselves who are, in the front lines every single day, worrying about exposure. And so when I think about, students in the CUNY system, I do think that there, is a real eagerness among most students to get that vaccine, to get both shots if that's what's required, and to really, again, do what public health experts have been telling us to do all along. I think what's going to be really important for young people with the vaccine is clear communication and I think that's such a huge part about making sure that students are, again, accessing the mental health services that we've talked about during this roundtable. And I think it's also going to be really important as we do actually have vaccines that are being distributed.
I think a little salute to our chancellor at CUNY, because he's been very, very determined to make sure there is good communication out to all the different colleges and to the students and the staff and the faculty. And I'm sure that they will be taking this very seriously and viewing it as an opportunity to make people throughout the whole system feel very connected. And let me ask you, Ryan, how do you see the vaccine changing the mental health challenges at CUNY?
I think the vaccine presents an opportunity for some of the alleviation of anxiety, obviously, for the reasons that people have been discussing. It'll be great, things can get back to quote unquote normal. I think it also has the potential to exacerbate mental health issues in a different way, because I think people need to continue to be really maintaining social distancing, maintaining masks until everybody gets vaccinated, until we can verify that the vaccine is working. And so my concern is that people will hear that this vaccine is widely available and stop paying attention, and some of the continued needs of protection and isolation may become frustrating for people. So I think it's a matter of one of the things that we've been working on throughout the pandemic, and we actually released a course at CUNY for faculty and staff. We're working on another one for students, is resilience, because this is a long haul. This is not something that's, even with a vaccine, is going to be a quick fix. There's going to be a lot to deal with. So it's important that people maintain not only their more acute mental health issues, but also the long-term issues.
One of the things that I've been wondering about is, we're talking about mental health here, and I'm wondering if a lot of us, even after 2020 is well in the rearview mirror, even after a significant portion of us have been vaccinated, are we at risk of having a kind of PTSD response, a post-traumatic stress response to the pandemic? Are we going to be able to go back to pretty close to normal, or are we still going to feel anxious and sometimes even more than anxiety? Gerard, you're a psychologist. What do you think?
Yeah, I've thought a lot about this. I think there's definitely going to be residual effects. I mean, just, coming out of getting people out of the house, and maybe, the fear and the anxiety, the angst that's been created now, it's gonna take some adjustment. And, just the hint of getting sick may bring on some real significant PTSD like symptoms on not only our students, but our faculty, our staff, particularly those who are more at risk for this illness. So yeah, this is not going to go away simply because of vaccine, because someone says, okay, it's all for us to come out. This, I believe, has changed the nature of society for a long time.
And people are going to have flashbacks. I believe that people are going to have flashbacks. And of course, we've all lost people. We've lost wonderful faculty through the CUNY system, and some students, and people have lost parents. So, the mental health challenge that goes with actually facing death and with having lost people that we cherish, that's still going to be here even when we reach a point of relative safety. Do you agree, Melanie?
Oh, absolutely. Yeah, I think the points that Dr. Bryant shared are certainly things that I know I'm both personally and professionally thinking about when it comes to the so-called return to normalcy. I'd also be remiss if I didn't, bring up, an issue that young people have been at the forefront of, during this entire crisis, which is certainly the racial justice uprisings that happened throughout the summer and, continue to move today. And so I bring that up because, I think, again, we kind of keep hearing this term of like coming back to normal, we'll be able not to wear masks, we'll be able to gather again. But, I think, for so many of us, and so for so many young people, that I think the last year has shown that, what is this normal that we're returning to, right? And who was thriving in that normal and who wasn't? And how do we bring with us all of the challenges, all of the change, all of the movement that we've seen in the next year, when we're finally able to gather again comfortably, when we're finally able to, see family members without being concerned about their health. And again, I think, as Dr. Bryant pointed out, there's going to be these residual effects where even if ostensibly folks feel or are safe or, the vaccine works, but I think there's going to be a long time where we're really kind of grappling with all of the changes that have come in COVID-19. And so, I think, when I think about all of the grief and, sort of the trauma that young people and everybody, a lot of folks have felt during this crisis. I think there's ways that this has profoundly changed us. I think it's, profoundly changed CUNY as an institution, and of course New York City as well. So I think that in a lot of ways, all of these intersecting challenges over the last year are going to come to a head, and we're going to realize that even if the immediate sort of medical emergency that is COVID, has gone away, the things that it has unearthed and made apparent and made obvious are certainly not going to go away, not without some real change.
And Gerard, do you think that there will be conflict about who gets the vaccine? And of course, when there is that kind of conflict, you would have mental health issues. You would have people very angry, potentially doing things they wouldn't ordinarily do.
Well, my hope is, if there's obviously the supply is limited or trickled down slowly, there obviously be conflict. There's already discussions about priority lists and things like that. And
right.
I'm sure students of color and families of color are going to always think that they'll be at the last of the line to get it. My hope is certainly these companies, and there'll be more companies that will come forward and develop more vaccines and deliver it in a very timely manner. And they do that, as Melanie said, with a lot of communication. It has to be a partnership, across not just in New York, but across the country, to make
right.
sure that everyone has access to these vaccines.
So, this has been really a wonderful conversation and really kind of right on the cutting edge of what's happening in the news and what's happening in people's lives. So I'd just like to give each of you a chance to just give a last word of advice on the topic of mental health as we go into these next couple of months. So Melanie, do you have just, sort of a 1-minute summary?
To me, I think the most important thing is to, again, to combat some of that social isolation that we're all feeling. We know we have to stay physically distanced, but don't stay socially distanced. Make sure you're staying connected with the folks in your life. I know I can be guilty of wanting to, connect out to people in my life. And then I'm like, or I could just watch, the next 8 hours of TV. But I think sometimes picking up the phone and just hearing from the people who do care about us, who are feeling it too, I think it can make us feel less alone. So just encouraging folks to stay connected, whatever that means to you.
That sounds good. Gerard, a last piece of advice for people thinking that perhaps they have a mental health issue.
Definitely ask for help. It's really important that people, the 3 hardest words to string together is I need help. And for folks to just keep that in mind, if you're feeling just out of sorts, you're not alone. Just know that you are not alone. There are millions of people who feel the way you are and who you feel. And it's okay. It's, there's this large stigma still out there about seeking help. But in these times, there's, teletherapy, there's so many modes to access help, and just do it.
Right. And we want our medical professionals, the EMTs and the nurses and the doctors and the people who work in the hospitals to also hear that message, because they've been under such tremendous stress. And some of them have had really crisis situations with their mental health because of it. So the message goes out to everyone, please. And Ryan, do you have a last bit of advice to the CUNY community about our mental health challenges and our resources?
My last bit of advice is to keep asking questions and keep being curious, which sounds sort of off topic, but it's not, and I'll tell you why. Obviously seeking help and asking for help is the right thing to do, but one thing we've seen throughout this whole pandemic is, especially working at an institution of higher education such as CUNY, is that, you know, our students are so interested in continuing to learn and research and due diligence into the kind of work that they're doing. And in the courses that I've been teaching, you know, a lot of the conversations have been about COVID and what's it going to be like and how are we going to deal with this and how are we going to look at the social justice issues in the next year when COVID is not an issue. And I think it's just remarkable to see those that are in institutions of learning and thinking to continue these processes as we continue to make our way through this era and onto the next, and how we continue with COVID and post-COVID and vaccines and all of the change that needs to come for things to improve for people across the country. So in a not help related way, I think that, you know, keep asking questions, keep making your voice heard, and you know, keep maintaining the leadership that everyone at CUNY is capable of.
I want to thank all three of you for being with us: Ryan Camayer, Melanie Cravelas, and Dr. Gerard Bryant. And for more information on mental health resources at CUNY, you can go to cuny.edu/mental health. That's where students can find access to mental health resource centers, and also check out the Healthy CUNY website, where there's a guide to surviving and thriving during this time and into the future. That's healthycuny.org/surviving and thriving. So thank you for watching. I'm Donna Hanover. Stay safe and see you next time.